Welcome to HCA Talks Health. I'm Zina Leroux, and with me today is Dr. Emma Presern. Dr. Emma is a GP locum. She's a lifestyle medic and the founder of Rebellious Health. Welcome to the show, Emma. It's really good to have you.
Thank you so much for inviting me on. Really appreciate it.
So what an interesting name for your company, Rebellious Health. Please tell me more about this and what your mission is, where it all started.
Yeah, okay. No, it's interesting how it sort of came to be, but Rebellious Health as a name itself actually came to me in a breathwork session that I did a few years ago. And this is all part of the unfolding of Rebellious Health and the seeds for it being planted. I guess Rebellious Health is a very big mission, which is totally not mine alone. It's looking at our healthcare system and sort of co-creating and reimagining a different or a more new health and well-being ecosystem. So rather than even calling it healthcare, health and well-being. But I think it needs to support the well-being of the workforce themselves, support the people who, we serve more holistically, but also respecting and thinking about our planet and planetary health, because our health is so inextricably linked to the sort of health of our planet. So it's a very, very big mission, but, I'm starting at the beginning and sort of going to the root, which is, I think, the healthcare workforce ourselves. We're seeing a complete burnout epidemic within the healthcare system, within my colleagues, amongst my colleagues. And, it's all very well and good talking about lifestyle medicine and preventive care and all of these amazing things that are being done. But if the healthcare worker themselves are the ones that are struggling, often silently, how can we pour from an empty cup? And so this has become sort of the mission initially with Rebellious Health. It's about giving ourselves as a workforce permission to realize that it's okay to ask for help, that it's okay to prioritize our own self-care first before anything else. And then we can move on to doing other better things for the healthcare system. So that's where it all started.
Okay, yes, very interesting. So thinking about you've mentioned quite a few things that sparked my interest, but you're saying that lots of healers are experiencing burnout, or maybe there's some healing that is needed for the healers, right? Tell me more about that. So is this a very common phenomenon?
I think it's extremely common, and I'm not sure that many people realize it until it happens to themselves, probably. I think the current system is so machine-like, it reduces everyone who works in it to sort of cogs in a machine. We're supposed to be efficient, compliant, we need to function just as is. But the system forgets that we are all such, unique human beings, diverse human beings with rich histories and different traumas and different financial situations and different ways we handle stress and resilience and different brain wiring, but we're all expected to kind of function in this one size fits all model, particularly with how we cope with what we deal with on a day-to-day basis. And we aren't taught how to cope with that, really. So many of us go into this profession at the age of 18 or, maybe a little bit older like me, but so young when you're making these decisions to embark on a profession like this. And, I think we all go into it for quite idealistic reasons. We want to do good and help people. But what I have noticed over the last few years, particularly with my journey and my colleagues, is that many of us, I think, need deep healing, and we don't realize that until maybe burnout starts to creep in. And it's a pattern that I've recognized, and other clinicians like Gabor Mate have talked about it a lot. But when I heard about it and when I started to think about my own story and my own journey, I realized that was the case. It's a profession that is full of people pleasers, chronic overachievers, rescuers. And, it's not our fault. I'm not saying this in a bad way, but it means we have neglected some parts of ourselves that I think we use work to cope with until that no longer serves.
And what difference do you think this could potentially make? So if the healers did get that healing that they so much need, in terms of the healthcare system or this health ecosystem that you are referring to, what difference do you think it would make?
I think so much of our the parts of ourselves have been suppressed on this journey. So I think it would bring so much more creativity and richness back into the way we practice healthcare. I think I think we are, well, everyone is creative. No matter what you say, we're all creative beings. That's something that's so unique to being human. And it's pretty stifled out of us on this conveyor belt journey that we all go through as part of our training and then working in the system that we are in. You know, it's long hours, it's hard work, it's competitive, and it's a very, yeah, it's, you know, in terms of right brain, left brain thinking, I think we've kind of gone very down the left brain thinking route within medicine, and we've neglected all that, the art of medicine. You know, they say it's medicine as a science and an art, and I think we've kind of really gone down the science route and we've lost the art, the connection, the creativity, the all of the more sort of intuitive, imaginative right brain ways of thinking. And I feel that as people explore that part of themselves more, you know, this could lead to, it could lead to sort of beautiful innovation happening within the system. And there are lots of amazing projects going on, you know, kind of around the world, around the country, but they're all quite siloed, and it would be beautiful if it all kind of came together, and we started talking about this more openly.
Definitely. And this is a statement that I've seen on your website where your dream or your wish is really to bring more creativity and humanity into the healthcare profession, right? And specifically for healthcare professionals. Um, but you also mentioned that this is something that you experienced yourself personally. So you went through a stage of burnout. Tell us more about your story and how it all, yeah, what it was like for you and also the recovery.
Yeah. So I was, you know, I had a quite a different childhood in the sense that grew up in lots of different places. So I moved around a lot from Nepal, Pakistan, Zimbabwe. You know, so I was surrounded by sort of beauty, mountains, nature, but also I saw firsthand quite a lot of inequality, and particularly health inequalities, poverty. And I think those sort of planted seeds as to why I, you know, wanted to become a doctor. As I said, I neglected the other part at that time. But then I sort of rejected maybe those parts of myself as I went into university, and, you know, you want to fit in amongst your peers, and then the journey to medicine is kind of long and grueling, and you are thrust into the hospitals at quite a young age without really the kind of support that I think is so desperately needed for healthcare professionals. And you are just you just do it, and you don't think about the consequences, and you look around and everyone else is just doing it. So over the sort of 6 years or so, the first 6 years of my career, I was just plowing through almost robotically, but becoming more and more exhausted. We were back in those days, we were doing 12, 14 days in a row sometimes, only having 2 days off. So I was just starting to become more and more exhausted, insomniac. I completely neglected any sort of semblance of who I was as a person, you know, what the things that I enjoyed doing, because you spend most of your time off literally in a recovery state where you don't do anything. And burnout for me, it's different for so many people, but for me, it felt like utter emotional exhaustion. I don't think I ever got to the point where I lost my own kind of empathy or compassion at work. So I would always give at work, and it left nothing for myself at the end of the day. And it got to the point where it felt quite bleak, because all my time off, I was just existing, and I really couldn't see how I could continue like this. I was so deeply, I think, just saddened that I was like, is this my life now? Is this it? And I was early on in my career, so it felt quite desperate, but I didn't really know what the way out was. I felt quite trapped. I don't think so many healthcare care professionals do, because it's such a vocation that you dedicate so much time and study to, and it becomes part of your identity, which is another issue.
Yeah, yeah.
But yeah, I didn't really recognize what was happening until 2019, which I sort of see in my life as the kind of the pivot point where I hit rock bottom, complete rock bottom. And as someone who has always sailed through university and exams and did well, and patients liked me and colleagues liked me, to suddenly feel like I was failing, like I couldn't do this, was a really big blow to me. But in the sense that I couldn't talk to anyone about it. So I harbored it alone. I felt a lot of shame, a lot of like, why is this happening to me? Because everyone else looked fine on the surface.
Yeah.
And yeah, it led to my first panic attack and at work, and then a sort of a long, steady burnout over 2 years. And I wouldn't have used those terms back then, because I didn't know that that's what was happening. It's only in hindsight where you can look back and think, oh yeah, that was burnout. And now, sort of working in this space more, I can see it rife in my colleagues and so many dear friends.
Mm. And I guess it's quite like you mentioned just now, it's quite difficult to realize it in that moment, but also to step away from what is causing the pain and the burnout and the exhaustion, because you've already invested so much time and so much money into this career. And like you said, it's something that you've taken into your identity. I am a doctor, I am a healthcare professional. So what did it take for you to realize this and to take the steps to get the support and the healing again?
In all honesty, yeah, I said it took 2 years, because so the first thing that happened to me in 2019 was that my mental health plummeted quite seriously, quite quickly, to the point that I scared myself. I was getting thoughts that I had never thought I would get, and as healthcare professionals, I think we think we're immune to this sort of stuff,
Yeah.
so we don't talk about it. Initially, I went to the GP, but I wasn't honest. The shame in me was so strong that I just said, I'm struggling a little bit with insomnia and a bit of anxiety. I didn't talk about the thoughts or what had happened. And so in 10 minutes, I was given the choice of antidepressants, sleeping pills, and eventually 2 weeks off work. But I was plagued with guilt, like plagued with guilt for being off work for 2 weeks, to the point that I did nothing that I should have done. I just isolated in my room, feeling more and more guilty about my colleagues who I had sort of let down. And I think this is all part of the problem. We feel such guilt attached to putting ourselves first, that it leads to these crises, these addictions, these mental health spirals, or tragically suicide, and it's such a problem within our profession. I think what happened over the next 2 years is just more and more awareness that I want my life back. I just remembered all these parts of me and I wanted it back. And so I applied for a sabbatical. That was my sort of way out, so to speak, during COVID. And if I hadn't had that sabbatical, I don't know where I would have been. I don't know where I would be now. It was transformational for me.
Fantastic. And I can imagine that, especially for you, as you've shared with your upbringing, being really adventurous and having lots of freedom and space to express yourself, I think it was especially difficult to be in a box, right, with the set structures and the set way to do things. So you had that year, the sabbatical. So what were some of the tools? What were some of the things that you did during that time to recover?
Yeah. Interestingly, also, just even talking about it now, I sold it as a year to get a sabbatical. I would go off and do all of these things and I would get diplomas and all of this. But deep down, I just knew I was like, no, I just need to rest. I really need to rest and I need to prioritize myself. But that doctor in me still had to justify that year out. Which again, part of the problem. But I did a lot of things that, in our mainstream medical system would be seen as rebellious, I suppose. So it's part of where the name comes from. But, actually all of the things that I use are completely common sense and there's so much evidence to back them up. So I think the biggest modality for me that's changed things has been breath work. It's something that I didn't know about 6 years ago. And I kind of stumbled into my first breathwork experience completely naive and unsure of what I was getting myself into. And it blew my mind, really, that I could have had such an experience using only my breath,
Yeah.
and I was completely cracked open in a way. And as someone who had built such a strong emotional armor around myself, completely disconnected from my emotions, very numb, this was a huge, huge point in my life where things changed for the better. So I went on a really big deep dive with breath work, exploring different styles of breath work, different modalities. And I spent a lot of time in nature. Nature is, I always talk about nature being like my therapist, my friend, my lover. Like it just provides everything you need. And I think if you ask most people what they do if they're stressed, they'll probably say they'd like to be out in nature. So I spent a lot of time out in nature. I did a long solo walk for 6 weeks through the mountains, a lot of soul searching. And this is where all these ideas for rebellious health started to kind of come through. And it was a very creative time. I rediscovered that I actually was quite creative. I did a lot of writing and a lot of, journaling, writing essays, and kind of thinking about this whole new mission with Rebellious Health. And part of my journey did also involve psychedelic therapy, which again, not mainstream in our medical system. And obviously, there's still problems with legality around the world. But more and more research is showing, how beneficial these natural medicines can be for mental health, for all sorts of reasons. And I was working in palliative care, and it's particularly in an area that, they could have a huge impact on people who are suffering with existential distress, and yet for political reasons or whatever, they're still not available. So yes, that was part of my journey, and it changed my perspective on health completely.
So you were experimenting with quite a few different things, and something like breath work, I find could really actually complement the medical system in quite a positive way. But so the value and the learning experience from that year, the sabbatical that you took, how did you take that into what you're doing today? Or, maybe also your upbringing, I guess, and the adventurous spirit and that freedom. How is that all collaborate or put into what you're doing today in with Rebellious Health?
Yeah, so Rebellious Health. So I've our main project is called the RE project, and it weaves in different elements of my journey, but all of our journeys. I think if anyone who's been on this path of burnout and recovery will notice some themes. But we weave the pillars of movement, breath work, plants, connection, nature, creativity, adventure, all into a kind of a container, a community together where we can explore these themes. And we are allowed to be vulnerable. We're allowed to take our kind of professional hats off and be vulnerable and tell our stories. And I think this has been such an important part for Rebellious Health's journey is, this kind of connection with each other and being able to talk with each other in ways that we have not been able to talk to, kind of professionally. through kind of fear of what the our peers will think, our colleagues will think, so it's organically growing, and it's I'm on my second iteration of the project, but it's weaving in all of these pillars, and it's introducing healthcare professionals. Lots of them already know about some of this stuff, but introducing these modalities into their lives so that they can start exploring their own stories, exploring their own desires, creativities, what they want from life, in terms of purpose. And so many people think, you must have purpose as a doctor, but it's really sad to see how many of us have lost that sense because of the systemic issues that we're facing.
Mm. So it's a way to support the doctors and the healthcare professionals, to bring some of these values back into their life, also activating the right side of the brain, the creativity, the humanity, and to encourage them to find new ways to practice, if I'm understanding it correctly, and to also take that into their when patient care and things like that. Is that right?
Yeah, I think, it's ripple effect stuff. I always bring breath work into my GP consultations because, as you said, there's so many different ways the breath can be used, for so many different conditions. And we're just not taught about this in our training or anything. So it's for them to experience themselves, but also, yes, maybe bring to their places of work, to start thinking more creatively about different projects they could do within their places of work. So just a little ripple effect stuff about it's bringing the basics back. I think we've forgotten the basics with all our shiny medicines and our fancy hospitals. We've forgotten the basics of food and nature and breath.
Yeah.
So.
And do you still see patients one-on-one, in obviously as a GP locum, or do you also you're a lifestyle medic? So what does that look like?
So I'm still working quite sporadically as a GP locum. So yeah, I still see patients in the NHS, one-on-one, yeah. But it's hard. It's becoming hard for me to continue, and that is something that I'm really grappling with at the moment. Despite me training in lifestyle medicine and, practicing all of these holistic modalities, I think the system is so constrained with what we can and can't deliver. And we're expected to see, upwards of 25, 30, 35 patients a day sometimes, given 10, 15 minutes. And in a world that is so complex right now, with societal kind of loss of community, social isolation, politics, financial insecurity, trauma, we're expected to deal with such big things within 10 to 15 minutes, which I think is so disrespectful to the patient and the healthcare professional.
Yeah.
And this is just fueling this burnout, this demoralization, and a moral injury that I feel quite deeply at the moment. And so systemic change is hard, right? I don't think we're going to see it from the top, sadly, like from the top down. And so Rebellious Health is just my small attempt at a little bit of a grassroots rebellion from within, to sort of say enough's enough, and to start all talking openly about where we could go and how we could change things.
But yeah, it's fantastic that you are speaking up and that you do want to make a difference. And I know we've touched on this quite a bit in our conversation today, but if you were able to wave a magic wand and you could completely change the medical system, what would that look like?
Oh gosh.
Putting you on the spot.
Yeah, no, it's something I've been thinking about, dreaming about, but it's not just my ideas, and that's the beauty of it. Like, it has to be co-created, because one person is not going to do this. It takes all of us. But first of all, the first thing I see is, okay, so I'm talking from the UK's perspective, where we've got our National Health Service, which, was born from such amazing kind of foundations and morals and values, free healthcare at the point of use. But the healthcare system worldwide, as in the mainstream healthcare system, I think has kind of taken a very dominant approach. So the first thing I would see is, bringing us back down and integrating with all of the other systems out there, the schools, the, holistic schools. And I almost feel like we need to have like a holistic health service alongside kind of the acute healthcare system, which is incredible for what it does. If you've been in a traumatic car accident, it is incredible at what we can do. But there is a vast sort of number of people who are being pushed into that system who shouldn't be there. And I think this is where we could create this ecosystem involving, whether it's lifestyle medicine, functional medicine, integrative medicine, Ayurvedic medicine, breathwork, yoga. There is so much art therapy, trauma therapy. It's not this system, and then these are all nice luxuries for people who can afford them to pursue. I would love to see all of this being integrated, and, maybe primary care is the hub and you kind of pivot out, or, because I think that's one advantage I do have with my medical training is being able to maybe discern when, it is appropriate to go to the shiny big hospital building, but also when it's appropriate to go down a much more holistic, nutritional, trauma-focused approach. So I see this mycelium ecosystem of everything with no hierarchy.
I like that. Oh, I like that so much. And there's more and more research backing up things like breath work and meditation, and putting them on par, sometimes even a little bit above some of the other treatments that we used to. So it's not just heebie-jeebie stuff. It's science backed, which I think that's what you're saying. Can we use all of these different modalities and support someone's health in the best way possible, in the way that they need? Making it an individualized approach, not just taking everyone needs to be put on this medicine or that type of approach. So I think that could make a big difference in healthcare.
Absolutely. I think you know yourself best, and because one science evidence randomized control trial says this, it's not for everyone. And I think people need to try this stuff for themselves to experience the benefit. But if you're privileged, you have access to this world. And that's something that I really grapple with, because so many people are missing out on the benefits because they don't have the means to access things like breathwork. When you actually come down to it, they're all free, right? To breathe is free, to be out in nature is free. So it's about widening access and empowering people to start looking at different avenues, and coming out of this, what I call a bit of a big drama triangle between kind of, the healthcare system, patients, governments and institutions, and empowering ourselves individually more.
So if someone's listening today and if they really resonate with what you're saying, they want to reach out to you, they want to find out, what you're offering, or maybe find out more about the RE project, where can they find you? How can they reach out to you?
So I'm on LinkedIn at Dr. Emma Presern. They can find me through my website, which is www.rebelliousmedic.com. I send out a monthly newsletter on sort of all musings, Rebellious Health, once a month around the time of the full moon. And I'm also on Instagram, Rebellious Medic, but I'm really happy to be reached out through any of those means, and through my website you can sign up for any information about the RE project and next iterations and next projects.
Thank you. So are there any last thoughts, maybe something that we've already talked about that you just want to reiterate, or anything else that you want to leave our listeners with today?
I just think I want to say that, if you are feeling lost or a little bit disconnected, or maybe you're starting to think, is this burnout, or you're sort of thinking what's going on within, I want to just give yourself permission that it's not just you, it's not your fault. I think so many of us take burnout to be a personal failing, but it's so much wider. It is so systemic, and it's a disconnection that our whole species has gone through in a way over the last however many hundreds of years, and I think we're seeing this played out widely today. But just be kind to yourself and realize that we haven't been born to live in this sort of world, this kind of capitalist do world. So be kind to yourself and take the time that you need if you need it. I needed a whole year away from clinical medicine to recover from burnout, and some people need longer. And so my only advice to you, if you're feeling like this, is give yourself that time, because so much can change if you give yourself time to remember who you were, and to remember all the parts that you've lost of yourself, to remember that we're all part of this beautiful planet and nature, and there's so much more out there. So don't suffer in silence. And yeah, take all the time that you need. If you can take it, reach out for help.
Thank you so much. Thank you, Emma. Thank you for sharing your story. Thank you for sharing your passion. Thanks for speaking up about something that you obviously deeply care about. Supporting the healers, bringing creativity and humanity back into the healthcare system, but also looking at these holistic modalities and what the best way really is to support people out there who are in need. So thank you. Thanks for taking this time to being on this show, and good luck with the important work that you're doing.
Thank you so much for having me. It was great talking to you.
If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and wellbeing coaching, visit www.healthcoachesacademy.com to find out more.